Hi, my name is Bradley Eberwine. I will be your recreational therapist for this initial assessment. Now, please have a seat and introduce yourself.
Hello, I'm Thomas Smith, and my wife asked me to come talk to you during this session.
We are here today during this session to help identify issues and to set a program to help achieve your goals. So please, let me know what issues you might be having.
Well, my wife really thinks that I've been drinking too much. She's been coming home in the evenings, and she says she finds me passed out on the couch, but I really think that I've just been taking these afternoon naps. I don't think that there's any issue. She thinks that I've been drinking too much. So she said I should come and talk to you about getting some help.
When did this drinking issue become a problem?
Well, I've been out of work for a while now, and I've pretty much exhausted all my possibilities of finding work every week, and I've done some yard work, and I seem to have more and more time on my hands, and I just think happy hour is starting around lunchtime these days. It's not every day, I don't think. I'm pretty much in good spirits, I think. But my wife says I'm not. She says I drink way too much. I drink every day, and she sees a lot of beer cans and whiskey in the trash can. So maybe I am. I'm not real sure.
Do you and your wife live together?
Yeah, we're definitely married, and we're having a good time. I think I just maybe spending too much time drinking when I should be doing some other things.
When did this drinking issue become a problem?
I've always drank. I would usually have a beer with dinner, for most of my life. I enjoy a nice whiskey after dinner in the evenings and that. So I really can't pinpoint an exact date of, say, a drinking problem started. My wife keeps telling me, oh, a month ago, you really started drinking way too much. So I don't know. I guess I'd say a month ago.
Do you have any other interests besides drinking? Like, do you like to do anything like outside in the yard per se?
Oh yeah. I really do enjoy yard work. I like to cut the grass. I have a push mower, and I just enjoy the exercise. I don't want to sit on a riding mower and do nothing. I do like the activity of pushing it. And then I have a great garden. I've been growing asparagus for years, and every year I try to grow a new plant in the garden that I haven't tried before. And then, well, I haven't done this much, but I am a really good baker.
Do you have any personal goals that you want to achieve while taking these sessions?
Well, I guess the more I think about it, I want my wife to be happy, and if making some goals during these sessions that I can achieve, that would definitely make her happy, and maybe it will help me get out of this funk. And I don't think I'm an alcoholic, but maybe I'll find out that I really am an alcoholic during these sessions. So yeah, I think we might get some good things done in this session. We just have to kind of decide what kind of goals I could achieve.
Is there any other support system that you may have other than your wife?
Well, I do have some really close friends. I have a brother or two that I talk to all the time, and then a couple neighbors, and former colleagues at work. I talk to them quite a bit, and we kind of have similar things going on in our lives.
Okay, well, I will be looking forward to your next session.
Well, yeah. Is there anything that we can do to have me, say, a goal? Do we
Yeah.
want to set some goals?
Yes,
Or?
we would like to set some goals. So, if you could possibly stop drinking for 2 days and be more active in your yard, doing more yard activities, that would be great. If you could possibly find some goals or spend time with friends, find activities to go. Maybe you go help do lawn care for your friend's yard.
You know, you've got a good point there, because we have an elderly couple that's right down the street, and I have noticed that their yard has been a little unkempt, and I haven't seen him out doing much yard work lately. So maybe he's had a little illness, and I could probably, maybe I could go over there and work on his yard, or go over there and talk to him and see what he needs done yard wise. I mean, they're getting up in age, so that might be a good thing for me to do. So yeah, I think I'll definitely be able to do that as a goal. You asked if I could stop drinking. Man, I really enjoy my after dinner Scotch whiskey, but I think for you, you've asked if I could cut that back. Yeah, I think I could definitely cut that out.
Do you like any other drinks, like water per se, or like a Coke? Because maybe you just have a Coke for the day instead of drinking alcohol. You find some other drinks that you enjoy and drink those, maybe.
Yeah, that's a good idea. I think, there are some of these flavored waters that I could try, and instead of making a screwdriver, I have one of these orangeade drinks. Because you can't taste vodka in a screwdriver, so if I can find something that tastes just as good as that, I could probably substitute that, and we'll see how that goes.
Are there any other interests that you have other than yard work?
I really do like to bake, and I haven't done that in a long time. So maybe we could say that, I bake a cake or make some cookies.
Did you bake for anybody other than yourself? Because maybe you bring breads to your neighbors.
That's a good idea. Yeah, I think that I could probably do that. I used to do that a lot, and I just, haven't done it in a while. So that.
Why would you say you haven't been able to do that? Because has your drinking become more of a problem with that?
I haven't really thought of it that way, but yeah, that may be interfering a little bit with my ability to be focused on baking something for somebody. You have to follow a recipe, so yeah, you could be right.
Has your marriage have any issues with you drinking? Like, have you ever had any issues with your wife while you've been drinking?
Well, she has been a little more upset with me lately. So,
but no fighting or no.
No, we don't really like any physical fighting or anything like that. She, she might yell at me for having an extra beer or something like that. So I think, like you said, if I can cut back on that as a goal, maybe that in turn will help with some of the yelling and screaming that we do back and forth.
Okay. That'll be the end of the session. I look forward to seeing you back here next week. Hope we are able to complete the goals. And I would like to reflect on how I did during the session. Now, I feel like I did okay with the eye contact, but I also feel like I could have spoken clearer more and could have asked better questions to be more informative with the client. Now, I think that I will improve as I get more practice with talking with patients. So I think this is great to do. So I will hopefully be able to do better on the next one. So thank you very much and have a nice day.